Hello, and welcome to the Uniformed Services Cystic Fibrosis Action Plan. This is a walkthrough video for the medical team, so let's get started. At the very top of the plan, you'll see that there are some demographics, and it's important to fill all of these in completely because the plan has background code to provide you with some clinical automation, and you have to fill out all the demographics to make it work. So first, we'll start out by name, physician name, and then these three important dates. Next, you'll progress through the CF medication selection screen. You click this, and what comes up are the most commonly used medication classes. It's important that when you're clicking these boxes, you click the ones that correspond to the needs of your patient, skipping the ones that your patient does not need. For instance, we'll leave off insulin, presuming this patient is not on insulin. You can see that these same medication classes we selected populate here, and that they do not populate anything for insulin because we want the patient to only see pharmacotherapy classes for which they've been prescribed. This gives us an opportunity to take a look at the stoplight system, which is the foundation for this plan. You have a green prevention plan, a yellow breakthrough section, and a red uncontrolled section. When we're going through this plan, these are just example medicines, doses, durations that I put in here, but each of the medication classes has a drop-down menu that show you the most commonly used medicines for each of those classes. And so all you must do is click them. If you look at the green zone, there are clinically validated pictograms that accompany the text. And it's important to make sure we personalize this to each patient as best we can. For instance, it starts by default as a child who's eating by mouth. But if you click this radio button, it changes to a child receiving tube feeds. And instead of eating normally, it is tolerating tube feeds. And this occurs throughout. If you hit the top radio button, it converts back to a child eating by mouth. Now, there will be some situations wherein you need more than the medication classes we provided you here. The default is for there to be no other sections, but if you hit this middle button, you have two new rows that populate. Perhaps your patient's got hypothyroidism, they need to be on Synthroid. If, in fact, you need more space, you can click this rightmost tab and start to enter it here. This is a perfect place to put in someone's chest physiotherapy and their vest settings. Perhaps that's 8 hertz and then start for 5 minutes, something along those lines. But it is a lot of space for you to customize this plan for your patient. If you want that text box to go away, again, hit the leftwardmost radio button and you're good to go. Now, if we go back up to the growth data entry, this takes data points from the growth curve that you've used for the vitals gathering of your patient for this encounter. But when you plug in these different points, you can actually generate an estimated caloric daily needs for a patient. This is just for an example, based on the resting energy expenditure equation and a conversion factor that was discussed and approved with our expert cystic fibrosis nutritionist. And you can see that it populates here. What's also important to notice is that we have some weight-based clinical automation. First, we put in 50 kilos, and so it outputs what the max units per day is, 10,000 units per kilogram per day. Then, if we actually make sure that we match the 2 enzyme doses that we are using, you can see that it tells you the max caps per day using this max units per day as a function. That can provide you some easier breadcrumbs with which to calculate your caps per kilo per meal or vice versa. Finally, you can see that in these text boxes for the yellow and red zone, if your patient is getting worse, you have the ability to free text. Perhaps those are going to be if-then statements or otherwise, like you can see here. You have a lot of room to customize to the needs of your patient. Finally, it's important to provide whatever the contact information is going to be for this patient so that they can get in touch with you if they need to. We hope that this has been an illustrative video for this clinical action plan and that it will improve your care of patients with cystic fibrosis. Thank you.